Hello, lovely people. Today we are going to discuss five medications you should never give as direct IV. First of all, let me explain direct IV. So, direct IV is the manual administration of a small volume, maximum 20 ml of concentrated solution directly into the venous system. So, it used to be called IV push, but it's recommended that that term no longer be used as it can be mistakenly interpreted as meaning the medication is to be pushed quickly in less than a minute, which is not so. So, there's a patient receiving direct IV. So, direct IV is not when medication is placed on a pump or added to an IV bag. So, the first on my list is potassium chloride. It's an electrolyte supplement used to treat hypokalemia. The IV dosage form comes in injectable solution. To administer, you have to dilute your prescribed dose in 500 or 1000 ml of normal saline to have concentrations not exceeding 30 millimole per liter for administration via a peripheral line. When you are done with that, you mix it thoroughly by inverting the IV bag at least 5 times. This is to ensure that the KCl is distributed evenly throughout the solution and subsequently giving you a very accurate concentration per ml. This is very important to do for the safety of your patients. And fluids that are compatible with KCl are normal saline, dextrose solution, Ringer's lactate, and dextrose saline. If you have to give concentrations exceeding 30 millimole per liter, essential venous routes and infusion pump control is required. The rate of administration too should not exceed 10 millimole per liter. If rates exceeding that must be used, you have to use a central line, you have to do cardiac monitoring and monitor serum potassium. It's very important to note that paravenous administration or extravasation can cause tissue necrosis. It can be so bad that the affected limb will have to be amputated, and so ensure that there is no extravasation. It's also very important to note that infusing KCl rapidly or undiluted can damage veins and also cause cardiac arrest, and you don't want to do that to any patients. The next medication is IV azithromycin. It's an antibiotic and macrolide. The IV dosage form comes in lyophilized powder for reconstitution. So to administer, you reconstitute your prescribed dose with the appropriate amount of sterile water. For a brand like Zithromas, use 4.8 ml to reconstitute the 500 milligram vial. After that, you dilute it in 250 ml or 500 ml of normal saline to have a concentration of 2 milligram per ml or 1 milligram per ml respectively for adults. You also ensure that you invert the bag at least 5 times to mix thoroughly and infuse over at least 60 minutes. The next medication is IV clindamycin. It's an antibiotic, a lincosamide. The 300 milligram solution should be diluted in 50 ml of 5% dextrose or 0.9% normal saline, and the 900 to 1200 milligram in 100 ml. So after that, you infuse over 10 to 60 minutes at a rate not exceeding 30 milligram per minute. So this is the infusion duration for the various doses. For the 300 milligram, you infuse over 10 minutes, the 600 milligram over 20 minutes, the 900 milligram over 30 minutes, and the 1200 milligram over 60 minutes. Number 4 on my list is IV vancomycin. It's also an antibiotic, a glycopeptide. The IV dosage form comes in injection, lyophilized powder for reconstitution. Reconstitute with 10 ml of sterile water for the 500 milligram vial and 20 ml for the 1 gram vial. After reconstitution, you further dilute the 500 milligram vial with at least 100 ml of compatible solution and at least 200 ml for the 1 gram vial. Fluids that are compatible with IV vancomycin include 5% dextrose, normal saline, dextrose saline, and Ringer's lactate. Is to be infused over at least 60 minutes for the 500 milligram dose and at least 2 hours for the 1 gram dose. It's very important to note that infusing IV vancomycin rapidly will result in flushing, pruritus, hypotension, and erythema. It's also called the red man syndrome. So the next medication is IV Cyclovir. It's an antiviral agent. The IV dosage form comes in injection, lyophilized powder for reconstitution. To administer, reconstitute the 5 milligram vial with 10 ml sterile water and the 1 gram vial with 20 ml. Go on and dilute in 0.9% normal saline or 5% dextrose to a final concentration of not greater than 7 milligram per ml, and then you infuse over 1 hour. Note that concentrations greater than 10 mg per ml increases the risk of phlebitis and is not recommended, like it's a not. Rapid IV infusion may cause renal damage. Always remember this hurting kidneys and say no to rapid infusion. Next is noradrenaline, also known as norepinephrine. It's an alpha beta adrenergic agonist, an inotrope. It's used to treat acute hypotension. It improves cardiac contractility and vasoconstriction. The IV dosage form comes in injectable solution. So the 1 milligram per ml solution should be diluted in preferably dextrose solution to have a concentration of 8 micrograms to 12 micrograms per minute for adults and to titrate to effect. So the FDA recommends diluting the concentrated dose in dextrose containing solution to protect against potential oxidation and subsequent loss of drug potency. The FDA expressly recommends against using normal saline as the sole diluent. The diluted solution should be infused into a central vein catheter or large bore vein. So if you are using a peripheral line, an upper extremity vein, preferably the antecubital, is recommended. Also, avoid extravasation as it can lead to ischemia and necrosis. So that's all for today. Thank you very much for watching this video. If you liked it, give it a thumbs up, share and leave a comment. Let me know in the comment section other medications you should never give as direct IV. See you in my next video and bye.